In this orthokeratology case, we have a patient who's gone from having a half diopter of against the rule cylinder in the post-wear refraction to now having a diopter with the rule in the post-wear refraction. There's also some complaint of glare or halos when it's dim, and we do see a fairly small treatment zone here on the most recent topography. Here's the lens that the patient is currently using, and one of the things I notice is that if you look at the back surface or the back curvature view, there's a little bit of toricity in the optic zone. You can see by the different shades of blue. And if we look at the actual numbers, about 0.8 and then about 1.7. So we're going almost a diopter difference between the two halves of the lens here. So we'll want to even that out. I'd also recommend increasing the size of the OZ. That'll help give us a slightly larger treatment zone and help with the complaint of glare and halos. I think freeform is fine for this patient. I would turn the blending back on. That means leaving the box unchecked. And then I would also uncheck the edge box. Even if there is some central corneal toricity or even scleral toricity, the corneal limbus is usually fairly spherical for most patients. And since this lens is landing pretty close to the limbus on the cornea, I think it's okay if we don't have a toric edge on this lens. We can leave it unchecked and that'll give us a spherical edge. So I think the easiest way to make those changes would be to go through the configuration settings here and choose one of our ortho-K. So I'm going to push the, right now we're at a 5.9 OZ. I'm going to push this out to 7.5 so that we can have a 6.9 OZ. And we'll keep the other parameters as you have them now. Yeah, I'm going to go a little bit higher on the topo demand because we're treating a fairly large area, even though the refractive error is not all that significant. And then we'll keep the overall diameter the same. You can pause the video while Wave calculates the lens. So here's a new lens. You can see that the base curve, the optic zone, is a single solid color now. I noticed that I did flip the edge thickness and center thickness. You had a slightly higher center thickness, slightly lower edge thickness. If that's your preference, that's okay. I prefer a slightly thicker edge, but you can switch that back. I don't think that'll make a huge difference in this case in terms of how the lens fits. And then I think the last thing we should do is adjust the sagittal depth and the vertical meridian so we can get rid of some of that axis 180 cylinder power that was coming through on the refraction. So this is going to be in 50%. Right now we're at a sagittal depth of 846 and we want to increase, so we're going to go up to an 856. There's 856, and then inferiorly we're going to do the same thing. Right now we're at 844, so we will want to end up at 854. Okay, so here we have a tentative new lens design. It'll appear as if the lens is lifting quite a bit in the horizontal meridian, but I'm pretty sure we'll still get really good applanation on the alignment curve, even in the horizontal meridian. So that's what I recommend for this particular lens at this point in the patient's treatment. Hopefully this is helpful. Best of luck, and thanks for watching.